Welcome to the iDryNeedle to the Point podcast. I'm your host, Paul Kaloran, and today we're talking dry needling in Major League Baseball with PT and baseball rehab expert Nick Thurlow. Welcome back, folks, to the iDryNeedle to the Point podcast. Really excited. We're kicking off another 8-week lineup of some awesome guests. We kind of took a break early 2021. If you've never watched the show, we had a previous rock star lineup of guests, so you should go back and take a look. If you've never checked us out, we're on Spotify, iTunes. You can catch the video episode on our YouTube channel. But this is To The Point podcast. I'm iDryNeedle president and founder, Paul Kaloran. I'm a physical therapist. I teach dry needling. And to the point, we're going to do our best to keep this short. I used to say 15 minutes, but we found that like almost impossible. And when you have guests like we bring on, you don't really want to cut them off. So we're kicking off the lineup of kind of the summer series, talking Major League Baseball. We've got a physical therapist, but really one of the best baseball gurus, whatever you want to call it. But this guy, he uses dry needling, and obviously we'll ask our dry needling questions. But if you don't follow him on Instagram, I'll drop his handle at the end, but he's purely in the baseball realm, really from youth to professional athletes. He works with athletes from all 30 organizations. And I'll let him introduce himself in a second, but I'm talking about Nick Thurlow. And if you are on Instagram, it's at nextera_PT. And it's one of those Instagram pages or feeds that you want to see. I mean, he drops how he uses needling. He goes into some of the exercises. He's got college and pro guys throwing balls. So it's one of those cool Instagram pages that you want to follow. Aside from needling, I know he's gone through some of the Kineticore training. He's got a laundry list of other stuff. He does SFMA, FMS, Spinal Manipulation Institute. He's done some baseball specific stuff like On Base U, even some PRI. Very accomplished clinician. But yeah, we're going to talk Major League Baseball and throwers and where needling fits. So Nick, welcome to the show. Did I miss anything? Say hi to the audience.
Hey, what's up, guys? No, that all sounded pretty cool. So
yeah. And I've kind of known you on and off for a few years. We've never actually met, but social media. Kelly Samus is one of our lead dry needling faculty, just raves about you, says you're an awesome guy. So really appreciate you taking some time out of the clinic. I know you kind of split time between your two facilities in Arizona and Colorado. So thanks for joining us. Yeah, no, awesome. I'm excited for this, man. Let's get it going. So yeah, kind of the first question we ask almost every guest, how did you become a PT story? And then really what got you into the baseball specific side of rehab? Yeah, so I'm the classic like washed up ex-athlete that was constantly hurt, throughout high school, and probably spent more time on a table than I did actually throwing a baseball. So, I was kind of always interested in treating baseball players. I think that overall it's a sport that has a really unique demand on it. So, and kind of having gone through PT myself, I don't think I was ever really exposed to kind of that traditional treatment model. And, here locally in Colorado, there was a need for it. There's not a lot of baseball specific facilities here. So, we kind of gained traction in that realm, and, we opened up NextEra about 4 years ago, and, we've been kind of running with it ever since. And now we've actually opened up a third location next week. So it's going to be a fun one for us. Man, congrats. That's huge. Similar question, but it's the dry needling one. How long have you been needling? Kind of what was your initial exposure? What training have you had? And then, one step further, how's your treatment model? How's your practice changed kind of before needling and after needling? So my dry needle story is actually kind of funny. And it's funny you mentioned Kelly, because she was at one of the first courses that I took with Kineticore. And, so I actually had a pretty bad experience with dry needling when I was in PT school. So, dry needling was kind of new in Colorado. Kineticore was just, I think, opening up back then. And I had a clinician needle me for some back stuff that was going on. And I'm pretty sure they hit like a dorsal root ganglion and had a little zinger down the back. And that kind of shied me away from it.
And then that combined with the practice I was working for a number of years, wasn't really into the whole dry needling thing. It wasn't something that any of the clinicians did. It wasn't something that they promoted. So, dry needling wasn't a big part of my toolbox for the first half of my career. It was more the FMS, the SFMA, manipulation type stuff. But then I had one winter off season when one of our pro guys came back, and he's like, "Hey, Doc, I need dry needling." I did it all season long. It's a game changer for me. Really helped me out. So back in like 2017 is when I actually was like, okay, we're gonna do this. We're gonna conquer our fears and go do some dry needling. And I've been running with it ever since. So as far as my treatment model, I mean, it's really been one of those things that kind of smashed the toolbox. It's one of my go-tos now. So we use our movement analysis stuff in conjunction with dry needling, and that's what really drew me to Kineticore was they had that SFMA component, which I was already familiar with, and we were able to kind of blend that nicely with the dry needling, and now we do all sorts of stuff with it, whether it's pre-post recovery, all that stuff. So
That's awesome. I mean, not that I'm happy you had an unpleasant experience, but I kind of like that.
Yeah.
Like, you get so used to everyone's like, oh, I had neck pain. My first experience to needling was that it was a miraculous improvement. But there are people out there, and I mean, teaching courses long enough, like there's people where the first needle they've ever experienced themselves, they have a sympathetic response. Some of them faint. I mean, it wasn't my first needling exposure, but I have a similar to you. I think there was a dorsal root interaction. That needle came out with about a 90-degree bend from the big erector twerk that I gave it.
Yep.
So my initial impression of needling I wasn't very impressed either.
Yeah, it's been nice though, because you get the, especially like the high school kids that might be afraid of needles, and you can kind of relate to them a little bit and kind of share that story. And it was funny. I remember in the Kineticore class, they came around and I had one of the instructors needle me for the first time, and after we were done, I was like, "Is that it?" He goes, "Yeah, that's what it's supposed to feel like." So it's nice.
Totally. So let's dive into the baseball realm. Before we even talk about needling, I mean, this is a unique population, or I'll say the demands of throwers or even baseball in general is unique to just even the general outpatient orthopedic population. So even before we start talking about needling, like you being kind of the expert here, what are some of the most specific or the more unique demands of this population that need to be addressed in rehab?
Yeah, I mean, I think the biggest thing is that, by and large, throwing a 5-ounce object 95 plus miles an hour over and over and over again year round is just not a natural thing. So you're going to see a lot of unique tissue changes that happen there. You're going to see a lot of nervous system changes that happen different times of the year. And you really just kind of have to understand that, I think the biggest mistake I see when somebody comes over from a different PT clinic or something like that is that they're really only working on that, like the shoulder area. And, just having that basic understanding of that kinetic chain of throwing is huge. And it goes a long ways with not only how you needle, but just how you program, how you treat, how you assess, and how you manage the nervous system throughout the year for guys. So it's a really unique thing. I mean, the amount of external rotation that guys are getting, you see those still frame shots of guys, with 120 degrees of external rotation. You just really have to consider that when you're using different tools. So, yeah,
I guess I've never thought of it as specifically as throwing a 5-ounce object 90 miles an hour, but that's the truth. That's what you're doing out there. And really, I actually shared before we got on, I literally have an N of 1 of a professional pitcher. I see a lot of athletes, but it's CrossFitters, endurance athletes, NFL guys. And honestly, I felt like he liked the experience. He improved some of his symptoms. We had 2 good sessions. Then he went back to his organization and is actually like a head trainer that kind of said, that scared him off of needling, basically saying, why would you do a treatment that would potentially increase your range of motion, put you at higher risk, all of that. So I'll just ask you, because you work with, you said like every single MLB organization. What's kind of the climate right now with each organization? Are they pro needling? Are they anti? Is it mixed?
It's pretty mixed. I mean, you've got your classic, guys that have been working in an organization for several years, and, they're really honed in on their craft and they're really good at it. I think what we're starting to see is a lot of younger PTs come up, through different fellowships and whatnot, and they're starting off in maybe like those minor league organizations, and they're meeting guys at a younger age, and then they move up, and you're seeing more of it. We had an interesting situation this past offseason with one of our big league closers who had come in, and he loves dry needling. This guy gets dry needled every Tuesday throughout the year. That was his routine. And I asked him, I said, okay, do you like stim with your needling? Do you not? And he goes, wait, you can put stim on needles? I was like, yeah, that's kind of our thing. That's how we like to do it. But, you tell me. And he said, hey, you're the professional. I'm going to trust you and try it. And he loved it. And so we ended up contacting the head trainer for the organization. And he goes, I know about it, but I'm just afraid to do it because I don't know how the athlete's going to react to it. And so, I think you've got this maybe fear of wrecking a $20 million a year arm. But I also think too that there's a certain kind of demand within organizations for some PTs that it's some days it's like triage for them. They open up the training room door and 30 guys walk in, and you got to cater to the big names and you got to cater to the guys that just had surgery, and they really just don't have that ability to kind of spend an hour with a guy to really kind of focus and do it the right way. So I think that organizations might tend to fall back on some of those more passive modalities just because of the environment they work in. So,
Totally.
yeah, it's definitely mixed. There's some really good PTs out there in organizations that do a good job, and then there's some that fight it. So,
totally. And I think you bring up a point that's not even like sport specific. Dry needling is so mainstream at this point that a lot of patients or athletes are going to come in and say, yeah, I've had needling. Either they liked it or didn't like it. And you almost have to qualify, like you said, what was it like? Was it 2 needles? Was it 20 needles? Did they use e-stim? Did they piston it? Because it's almost this umbrella term that there's so many different schools of thought and even like clinical applications.
Yeah.
Go ahead.
Yeah. I was to say to that point too. We've had guys that come in, they say, hey, needling didn't work for me. I remember we had a Rockies player that he had some just patellofemoral stuff. And I said, well, what'd they do with you? And he said, oh, they just needled my quad. And then we go through our exam, we find this guy's stuck in a ton of, anterior pelvic tilt and doesn't fire his glutes. And I'm like, dude, let's needle your back and your glutes. And I bet you your knee feels better. It's going to improve your movement quality. And he's like, okay, I'll agree to it a couple times. But after that, if it doesn't work, then I want the regular stuff. So, and it worked. So.
Nice plug for SFMA there. Whether you do SFMA or FMS, that little scenario Nick just mentioned is that's why you need some sort of functional assessment. So we're not just treating what hurts or where it hurts. Yep. And your last answer actually kind of led me to the next question. Not just how we use needling. Andreas Olson was on last season and he treats only NFL guys. And he made a pretty specific point that the way he treats and uses needling in season is very different than how he uses needling off season. Is that similar for you and the pro guys for baseball?
Honestly, with pro guys, there really isn't an off season anymore. These guys maybe take a week off to, spend time with their families or whatnot. But the facility that we work with really closely in Colorado and Arizona, Push Performance, that's our strength and performance facility. These guys are coming in and they're throwing year round. They're throwing bullpens year round. They're doing, different things throughout the year, depending on, whether they're a starter or a reliever or a position player. So, the in-season, off-season doesn't really vary a ton. I would say the weekly schedule is a little bit different. Monthly as well. It just kind of depends on where they're at in their load. But pro guys in particular, I kind of mentioned earlier with the closer, relievers, they might just pick a day and they might just say, hey, on Tuesdays, I'm going to get needled. That's just going to be my routine. And then, maybe they had a higher load that week. They might come in for some post-throwing recovery work. They really like to get in and do some low frequency needling and some soft tissue work and things like that. Those guys, we also like to follow them up with some blood flow restriction. They really respond well to that. Our starters are just kind of a mixed bag, man. Pitchers are weird. They're all over the place. Everybody likes something different. So, we've had some pro guys that want to get needled the day of, and that's theirs. I'm not a big fan of it, but some guys do really well with it. Some guys do really well, the ones that, don't really get sore and they just want to restore some motion and kind of tap into some movement that they don't have. They'll do maybe the day before, but I would say by and large, guys are coming in the day after. So.
Yeah. And that all makes sense. I mean, NFL season is grueling in other aspects, but I guess even a short week, you have, let's say you play Monday night, you have 5 days to kind of recover and you can build kind of a consistent schedule. Just the length and the consistency, frequency, like number of games per week, I'm sure it's more of a challenge. And you actually started to get into my, one of my next questions. I guess you said sometimes it's kind of preference or request, like treating them right before or right after. Let's say a thrower comes to you and says, how soon before throwing should I do this? And then how quickly after can I do it? If I'm looking for recovery or something like that, what's kind of what are your guidelines or what's your answer?
Yeah, again, I mean, it's just like anything in our profession, right? It kind of depends. So, like we had 2 pretty high level high school kids in here this morning that they're throwing tomorrow. And these are guys that, their team kind of leans on them a little bit. So they're kind of high mileage guys and they get used a lot. They're also throwing bullpens throughout the week. They're doing their strength training throughout the week. So they just like to feel their best going into it. Versus some guys might just feel like, hey, I only need it afterwards. Maybe they feel a little bit too sore from the needles beforehand and they're going to stick to more of the after. But like I said, everybody's a little bit different. I would say that by and large, these guys are after they throw, they're going to gain a ton of external rotation. They're going to lose internal rotation and they lose overhead flexion and they get into a lot of kind of spinal extension. So the ones that are really kind of, losing that tissue quality, they're going to do better after. The ones that move well throughout the year, sometimes they just like to do it beforehand just because it feels good and they like to go out there feeling their best.
So since you brought up that scenario, kind of a follow-up question to that, because like you said, some guys are going to increase range of motion and sometimes you're treating right before, maybe even day of. So what do you do aftercare or almost like an immediate reinforcement strategy if you're needling them and they're about to go out and throw? Like what's one thing you give them? I guess you said you use BFR. Do you do taping, any sort of stability training? And then what's one thing you do right after if they just got off the mound? So the goal is almost recovery.
Yeah. If the guy's coming in like day of or day before, we typically won't turn the stem up super high on them. I find that kind of makes them a little bit sore. Maybe not leave it on as long either. But then we like to follow it up with some neuro training. So we'll do some dynamic stability work. We might take guys through and do some plyo care with them. So we'll do some like over the shoulder decel catches. Sometimes we'll do, I don't know if you're familiar with like the drive line stuff, but we'll do some reverse throws. We'll do some pivot picks, just some different kind of patterning drills for them. We like to use a lot of just kind of like positional breathing work. So if it's a guy that's got like a really expanded thoracic spine, we'll work through some different drills for that. And then just make sure when they get to the field, they're doing their full body kind of dynamics. So that's kind of your typical, day of or day before. It's really centered around like getting the nervous system primed and ready. So, we might even needle like a little bit more centrally day of too, especially I think the cervical spine is extremely undertreated in the baseball population. We know that there's things movement wise that link the neck up to the shoulder girdle. So we might get into areas maybe not, directly on the elbow or directly on the shoulder and spend more central needling. And then more afterwards, we're going to kind of get in and just blitz everything. I mean, anything that's not moving well, anything that's sore, we're going to use that and then, double down on some soft tissue work and then maybe some light dynamics after that.
I love it. I mean, first of all, I love just the nervous system influence or impact, just the rationale of that explanation.
Yeah.
It's a big part of how I explain it now. I guess when I first started needling, I was really good at explaining tissue health and oxygenation and nutrition and all that. But even though my treatment, maybe I use more stem, but my treatment is not that much different than what it was. Just my explanation is different.
Yeah.
But I love your strategy. I mean, you're a mixed bag. You use BFR. That breathing is PRI influence, I'm assuming, which honestly, a lot of the NFL PTs use that as well, both for rehab, but also for kind of recovery strategies and how it impacts patterns. And then obviously I like the needling in the toolkit, but you're a dangerous PT.
Hey, we try to be, man. We try to be.
So trying to keep this short, we're going to wrap it up. So let's, I'll toss you one more question, and you kind of went there already, but giving the audience, let's say that there's PTs out there in the outpatient ortho setting where they see a thrower every once in a while, like a high school thrower comes in, they see 1 to 2 at a time. What's just 1 or 2 tips, little nuggets you'd give them? It could be how to needle, something to look for in an assessment, or just like a go-to corrective. Like give them one piece of advice.
Yeah, I think the biggest thing for me, a couple things come to mind. You know, we talked about a little bit, you know, that those extreme end ranges of external rotation that you get there. And a lot of, you know, we definitely go to the backside of the cuff. I mean, that's a huge one. I really like to do some like myotomal type needling for afterwards. So, you know, really kind of hone on the nervous system. So we might set up a guy like prone into his like kind of arm slot, put him into a little bit of external rotation with like a yoga block or something like that. And then link up that posterior cuff with the cervical spine, and we'll needle that together. That's a really good kind of like motor control one for us. My definite favorite though is those guys that are coming in with maybe some like, you know, quote unquote shoulder impingement. They just kind of have that general anterolateral shoulder pain. And a real home run for those guys is to, you know, put them in supine and get them into an uncomfortable range of layback or external rotation and kind of make it relevant to kind of where their arm slot's at. And we'll go ahead and we'll do subscap and lat, and then maybe even get into the tricep area a little bit. And, you know, that subscap is just such a big stabilizer and that eccentric, you know, kind of external rotation. And I don't think there's a better way to get to the subscap than, you know, with a 60 mil, 75 mil needle. I mean, there's digging your hands in there. I just don't think you get it. And what we find is that when you get into that position, a lot of that kind of front side shoulder pain will actually clean up. And then along with that, we like to hit subclavius. Subclavius is a huge one that really kind of lifts that clavicle up off the joint, off that AC area, and kind of provides a little bit more space in there. So that's kind of the 2 big setups, you know, kind of an anterior setup and a posterior setup we like to use.
I love it, man. That's great advice. You kind of have some functional positions, gave you a few key muscles. Like how many of you out there, even if you were trained in it, have a good reason to hit subclavius? I mean, that's kind of one of those forgotten muscles. So try it out for your throwers, and specifically saying kind of that positional provocation or that impingement type stuff. From the mouth of the guru, the baseball expert himself. But that is time. Nick, perfect. Thanks so much for joining us. If you want to see kind of how some of the setups he just mentioned and actually see it, like I said, he posted on Instagram. He shows how he needles, what he does afterwards, for, like we said, for rehab, for pain, for recovery, but also post-surgical. And all of that is at nextera_PT. That's Instagram and Twitter. So if you don't follow him already, it's worthwhile. It's one of those like valuable Instagram pages to follow. Otherwise, like I said, we're kicking off a roster, I guess, of 8 straight weeks of new To The Point episodes. So they'll be dropping every Wednesday. So if you're listening to this one, we'll catch you next Wednesday at the same time.